Okay, thank you so much for coming, everyone. So, what is the most prevalent disease known to man that affects man? Yes?
Body sickness.
Body sickness, okay. Okay, but what specific disease that affects, what's the most prevalent disease that affects men? Men, women, children, you know.
Heart disease.
Heart disease? What? Heart disease what? Aging? Actually, that's...
I like the way you think.
Actually, is that a disease? That's a question. Is that a... It hurts the human body. Okay, okay, okay. And I like the word aging. So actually, it's gum disease. According to the Guinness World Book of Record, gum disease is the most affecting disease that affects man. It is a chronic disease, and it not only does it affect so many people, but it's also contagious. I had this one patient that she had really nice pink, healthy-looking gums, and so when we detect disease, we use a probe. It's like a measuring tool, and you go, if you think about each tooth as an individual castle, and each individual castle has its own individual moat, and in that moat, that's where we measure to make sure it's healthy. You should have a measurement of 2 to 3 millimeters deep. And when I go down in there and measure it, like I said, her gums looked pink, they looked firm, they didn't look too puffy. And when I went and measured, I was getting 5, 6 millimeters. That's a lot of bone loss. It doesn't sound like millimeters or that big, but in the mouth, it's ginormous. And
But how can you tell?
Sometimes you can't.
With a probe?
The only way you can tell, that's a great question, thank you. And thanks for being here. Really, the only way that you can tell is by someone measuring the health of your gums. I mean, you can get a flashlight that John took to go find out where the leaky gut comes from. You can look in your mouth, which please do, because it did stop.
It has stopped.
It did stop.
There's still something.
It is still something. I mean, when we look at our hands, we look at them and we notice if there's a splinter. We notice if there's an ache on our body. We notice things, but do we take a flashlight and look in our mouth and see what's happening inside? Do we look at our tongue? Do we look at our tonsils? Do we examine our mouth like we do examine our bodies when something doesn't feel right? And so take a flashlight, look in your mouth, and yes, you can't take a probe and measure your gums, and that's one reason why it's very great and a great idea to go visit your dentist to measure the health of your gums. And so I was measuring her gums. I was getting 5, 6 millimeters, which means that she was losing her jawbone, because like I said, anything over a 3 means that there's either inflammation in the gums, and the gums are puffy, or there's actual bone loss. Especially in 5, 6 millimeters, that definitely means that there's bone loss. Your jawbone is going bye-bye. And so, thanks for that. I need that. And so her gums she was losing bone, and I said, so we did some home care. I did some treatment on her, and she did some treatment at home. She came back in 3 months, 6 months, it wasn't getting better. I said, what is going on? And so I started talking about her husband and asked, how's his mouth? And she said, you know what? Actually, that's a good question because he's been having some pain. And I said, bring him in. His teeth were flopping in the air. I mean, they were loose. And I just went, and I measured, and it was like 8 millimeters. I mean, they were so bad, I couldn't help him. It was too beyond my expertise, and so I referred him to a periodontist. He got under control, and then her gums got better. And then I've been seeing her regularly, and every once in a while they get out of control, and I said, how's your husband's gums? And she'll say, they too are getting bad. I said, yeah, guys, get it back together. And so it's just interesting how it is contagious. That's my story about contagious.
From kissing?
How else? How else is it contagious?
Well, I don't know what everybody does in their spare time. I'm just wondering.
Well, what about eating off of people's utensils? What about, can I have a bite of your food?
Oh, I do that all the time.
Yeah, and guess what you're getting?
I also kiss people all the time.
And guess what you're getting?
Gum disease.
So guess what? Because it's a chronic disease, if it stays for a long time, sometimes gum disease can be acute, right? Sometimes you can cut yourself. Sometimes it could just be a sudden bleeding effect. But when it stays in your mouth for a long time, then it's chronic, which means that it's lasting longer than a small moment, such as an acute moment. And it's affecting heart disease. Look at that.
And why does it cause heart disease?
Yeah, that's a good question. And look at dementia and Alzheimer's. Because this bacteria is the same bacteria that gets into your bloodstream. Do you like how I look at you because you just ask the questions?
Well, because I have this joint. I want to know what's going on.
You know the answer, so
But
thank
I
you.
don't know a lot about, I know a lot about marketing, but I don't know a lot about what you know.
Okay, and you know what? I'm going to pass out some of these books and these things that y'all can be looking at and reading while I'm talking, because the thing is that, like I said, bacteria is contagious, right? It's something that you can pass. So also it can also pass the membrane of your blood and get into and almost make it so that your arteries are almost like a Velcro, where when there's inflammation, the bacteria can stick and then cause more problems on your artery. And then that affects, obviously, your heart. And then they just found out that the spirochetes that are found in your gum disease is also the same bug that causes Alzheimer's. Mm-hmm. And that was just a recent study in the last couple of years. And then also it can definitely help with pneumonia, which is definitely affecting the elderly, especially in the homes where they are getting a lot of that. So we think about that my gums bleed. Sometimes we think, well, they've always been bleeding. It's fine. It shouldn't be a problem. If you wash your hands and your hands were to bleed, what would you do? Exactly, right? Wouldn't you just like try to clean it and put something on it so that it would heal? And so why don't we do that with our mouth? Why? Okay, and actually saliva is a great neutralizer, because saliva is huge. It is good that God gave us saliva, because saliva is a neutralizer. And when your mouth is very acidic, your saliva helps not only for you to speak, but it also helps you to neutralize the acid that's in your mouth. Because bacteria plus sugar equals acid, and acid plus a tooth equals decay. And also it can also equal gum disease, which is, again, think about a tooth as a castle, and you have ligaments, and just like every kind of joint, not that your tooth is a bending joint, but there still is ligaments that is attached to your jawbone, and that ligament and your gum is the pocket that supports that tooth in your jawbone. Does that make sense? And then that periodontal disease or periodontitis is inflammation in that surrounding structure of that tooth. And that's what helps. That's the most prevalent disease known to man. So I love this. I don't know if you all read this right here, but Richard Voll, he's a doctor dentist and a German physician, and he studied the mouth, and he's estimated that nearly 80% of all illnesses is related entirely or partially to problems in the mouth. And I think that when we have like sore knees, or something happens, we go and we do our best to figure it out. But in our mouth, again, what do we do to find out what is going on? And again, use a light and see what's going on in your mouth. Take a big mirror and literally look in your mouth. Find out how many teeth you have. I'm amazed how many times people don't know. I mean, granted, I know that they don't know which tooth is which, but sometimes they don't even know which teeth have fillings. Like, just really, this is your body. And remember that song, the head bones connected to your backbone? They forgot the beginning of the song. Your teeth bone are connected to your jawbone. Your jawbone is connected to your neck bone. Your neck bone is connected to your backbone. And And guess what? Okay, never mind. We'll get there in just a minute. So the biggest thing that I wanted you to know is, again, how the mouth is connected to the body, and how it is related, how your teeth and your mouth and your jaw, it's all connected. So just really just get that in your brain, because it's not its own entity. Sometimes we just think that your teeth, if there's a problem, who cares? 78% of pathogens from oral infections are in the blood clots, because people that have heart attacks, they all had problems with their mouth. And there you go, some more research. Okay, we're over it. So now, going to the dentist, most people don't see their physician regularly. How often do you see your dentist? Sometimes we are the first people that see a problem. I remember Dr. Jorgensen was doing an exam, and she noticed a problem on someone's lip. And she said, yeah, I've been noticing that. And we sent her to go get it tested from a dermatologist, and it was cancer. And so she had to get it completely cut off. And then, so sometimes we see patients and people more often than they go see their physician. I do believe that you are your best doctor for yourself, because you've been with your body the longest, and you do know what is going on. And so you use the doctors, the physicians, your dentist to gather information that they have to help fill what is right for you. Because, you know, you might know that, because sometimes people will come in and they're like, your gums don't bleed. Why are they bleeding? What's going on? And then they lay on all the stress that has been happening in their life. And I'm like, oh, honey, you need to relax. Because stress, just as you know, causes bleeding gums just as much as ulcers, other problems. Stress is a huge factor for bleeding gums. And we sometimes think that, okay, we got to brush and floss, and that's what cures bleeding gums. The biggest thing sometimes is learning how to relax and decompress. And that's it.
I didn't know that.
Yeah, it's inflammation.
Yeah, I guess you're right.
Inflammation. What's inflammation? Inflammation, right? Well, what is? I mean,
Swelling.
it's swelling, exactly, and it's red and it's puffy. And my kids sometimes say, Mom, you ruined it. Sometimes I just can't kiss people because I see their gingivitis.
Or smell. I know, it's really limited to the dating pool. That's his age.
All right, so as inflammation increases, so does your CRP, which is your inflammation factors that you can get tested. And people with periodontal disease have a 20% greater chance of having a stroke. Thank you. What did I say?
20.
Thank you. Appreciate that. Yes.
I'm sorry, but I have a story you must hear.
Oh, please tell us. Does she need a microphone?
Oh, no, my mom was in wonderful shape, except for she had sores in her mouth, and she had no idea why. And she had gone to several dentists and doctors, and they just kept giving her medicines and salves to get better. And then one day, she and my dad were coming out of the temple, and she just had a stroke and died.
Died.
And she was the kind of person that if you walked into a room and chose who would be the last person to die in that room, it would have been her, because she was so active and healthy. But she had these sores in her mouth. Anyway, long story short, when I came to work here, I told Dr. Jorgensen, and of course, if only we had known her, she knew exactly the name of those sores, by the way I described them. Pimpagus, I think it was called. And she did tell me, yeah, there's a bacteria in those that attack your brain and causes strokes. And I was like, Mom. So,
Dang it!
Yeah.
Dang it!
I know it. So, it wasn't that she wasn't trying to get well.
No,
It's
yeah.
just that not people, even the best doctors, didn't know what was wrong with her.
Wow.
So anyway, and
No.
she just, thought, well, I guess they're just like canker sores, and I'll just be tough. So anyways, I'm just saying.
And that
Weird,
is a good comment. By sometimes we think that it should go away, but if it's not, that's something chronic. And so that is something that if you're not getting an answer from someone, go find somebody else.
Right.
Yeah,
Yeah, had we known about,
I know.
but anyway, so Yeah, it's not a lie. It does happen.
And
It does cause
sometimes,
strokes.
yeah, and sometimes we think it will happen to somebody else.
Mm-hmm.
But when it happens to our mom,
Mm-hmm.
it breaks our hearts.
I know. Yeah. So that was a shocking day.
And yeah, periodontal disease leads to increased occurrence of pneumonia, leading to the cause of death in nursing homes. So what causes periodontal disease? So there are many factors, and I'm going to bring this pie chart that tells why do we get bleeding gums. Some of it is we made a wrong choice and we chose the wrong parents. And, okay, are the wrong grandparents, are the wrong great-great-great-great-grandparents. So what do you do on that? Obviously, you can't do anything about that. There are some certain things that you can do to help with that pie chart. Diabetes, smoking, what else is there on there? Definitely stress, not sleeping, some herbs, I already said medication. And if you chose the wrong sex, because sometimes women have more hormonal problems, which definitely influences more bleeding problems. As you get older, your gums have more problems too. So when you're younger, but see, you shouldn't even have problems as you get older. That's even a wrong thing to say right there too. So yes, so please. So yes, and like remember what I said about kissing people? Yeah, and and also bugs are very opportunistic. That one word that I'm trying to say, opportunistic. Say that word. Opportunistic. That word. And they'll take advantage if your body is not able to fight off diseases. It will cause problems. Sugar's an inflammatory. Grinding your teeth. Now, how do you think grinding your teeth helps you lose your jawbone? Let's think about that one.
By grinding it down or what?
Okay, you're grinding your teeth, yes, but how do you lose your jawbone? By grinding your teeth.
I just assume it was stressful.
It's a lot of stress, right? So think about it. Do you want to be a tooth for me, sir?
Okay.
Okay, stand up.
I
So,
have gum in my mouth.
okay, so if he's a tooth and another tooth is right here, but I'm not hitting it straight on like this, but I'm
Nothing in the way. You should be able to hit it really clear.
so, but if I'm hitting it to the side like this, and I keep jiggling it, and let's say that this is his. Remember, this is his crown, and then this right here is his gum area and his jawbone. But if I keep moving him like that,
I'm getting loose.
okay, yeah, you're getting loose, right? And so what's going to happen? Your gums are going to recede, which means your bone is going to recede because the gum and the bone always have 2 millimeters in between each other. So if your gums recede, you've lost your bone. No, go, okay, you're good. Thank you. So grinding,
Teeth causes that
yes.
because it moves them.
Yep. So there's, so it's just not a matter of just cleaning your teeth and what causes that. So, and also nutrition, I had this one patient, she just, fire. Her gums were on fire. And they were just so red and inflamed, and we got her on some major vitamin C, even vitamin C IV, and she started getting better. So again, host response, that's a huge one, and nutrition. Okay, so definitely the best, what I love big time is this Cyruta Plus and coenzyme Q10. This is so huge because this has a lot of collagen in it. It's a great source of vitamin C, and it helps not only with bleeding gums, but also with your blood vessels.
Cyruta?
Cyruta! So again, the healthier that you can be, then the stronger your gums will be. I just remembered something. Wendy so she's the other hygienist, and she wanted to say this. We brush our teeth at night so that we can what?
Get the food off.
Get the food off and keep our teeth, right? Why do we brush them in the morning?
Because there's toxins and stuff.
Say it louder.
We have morning breath. For our neighbors. For us. That's what I was telling her.
There you go.
It's for ourselves.
At night, it's for ourselves, and in the morning, it's for our neighbors. Okay, and there was another one. If dentists make more Okay, if dentists make money off of people with bad breath, why should I trust a toothbrush that 4 out of 5 dentists recommend?
Okay.
Don't you like that one?
That's a good one, yes.
Okay, and then, okay, here's another one. A woman saying she's not mad at you is like a dentist saying you won't feel a thing. Okay. Fun. Okay, that was from Wendy. Okay. So one way that we help with treating gum disease is just like what you were saying. If you had some owies, you would put something on it. Remember you said that? So one thing that we do is first I'm sure you would clean it out, right? You'd make sure if there was a splinter, you would pull it out. That's what scaling is like. So we pull out the splinter, and sometimes we need to numb you because sometimes it hurts to get down in there and clean it out. So we clean it out, and then we put something on there. One thing that we use is ozone. What's ozone is it oxygenates the bacteria, the fungus, the spirochetes. That's still bacteria. What am I trying to say? The fungus, the bacteria, the virus, and the. Okay. So anyway, so it oxygenates those, and then that's what we love about the ozone, because then they oxygenate and they obliterate each other. And we can also use the laser to help disinfect the pocket. Is that Dr. J there? Yeah. Ask her about the ozone. It's virus, bacteria, fungus. I swear there's a 4th one. Anyways, so that's how we help remove that. Oh, wait, and so what I wanted, so it was parasite. Yeah.
We're thinking bacteria and parasite, same thing.
Yeah,
It's not.
yes,
It's different.
yes.
How do you apply the ozone? Like,
Thank you. I appreciate that because,
I've heard of ozone saunas
yeah,
and IV
thank
ozone,
you.
But then
Perfect, because there are different ways. I appreciate that. So what I do is I do it 2 different ways. We do it here in the office. Actually, we do it 3 different ways. So we have it in a gas. We make it into a gas. We can either inject it into just a little bit into the site that is in that there's an issue. I use like a little water pick, kind of, if you will, like a little like this. Okay, like if you had a little water pick, like a water gun. And so the gas comes out of that, and then I keep it going, and then I put it in that natural pocket. Yeah, and so that's how I do it around each individual tooth. And also ozone's really great for sensitivity. You know, like how sometimes the gums recede, and so then if we put it on there and I hold it there for a while, then that will help close the tubules, because your nerves go through there, and we close that. And then another way is we ozone water, and then I irrigate. So those are the main ways that we do it. We haven't done IV, we haven't done that, but we definitely have injected it. And Dr. Jorgensen has injected it on me down here to stimulate my parasympathetic, my vagus nerve. And it feels so good.
Why'd you need to have that stimulated?
Just to get in a happy place.
Oh, for real?
Because it resets you.
Let's try that.
No, it feels so good. You got to try it.
Endorphins or what?
Yeah, because when you get your parasympathetic nervous system stimulated, it definitely puts you into
Zen mode. Okay.
So is that the same as prolozone treatments, like that people get
Yes.
in their knee or something
Yes.
like that? Okay.
But yes,
It's like
yes.
all the same. Different
Thank you.
modes of
Thank you. Yep, you're so
Why
on
do
it.
you use it sometimes in olive oil?
Oh, because when you sometimes you don't. Some contraindications are in your eyes and in your lungs. And so if we want to put it in your ears, which then can get into your lungs easier, you want it not so.
No, it dilutes it.
Yeah, and you don't want it in your lungs.
Okay, why would you put it in the ears?
To get for your ear infections,
Oh, okay.
and it's also close into your sinus cavities.
Okay. Gotcha.
Okay. So can I have Gracie and Stacy to come up here, please? Oh.
It's okay.
So I have my beautiful teeth right here, and they are connected to each other. Now, again, one thing that I love about looking in your mouth, sometimes some teeth are like this, and that makes it easier for the bacteria to get right in those crevices. So again, use your light and see what your teeth look like. Get in your mouth. Now, with your toothbrush, you can be straight teeth, thank you. This is the crown of your tooth, And then you have your gums that come up right here, like in the neck, and then you come down in there, and that makes that natural pocket. Now, when your gums recede, then you'll see, this is called your enamel. When you come down here, you'll see your cementum. And when your cementum is 7 times weaker than your enamel, and so you want, if your cementum is showing, you want to find ways to strengthen your enamel. And you can do that from the inside out by eating healthy things to get into your blood vessel. And you can also just pet it.
Hopefully your tooth isn't hairy.
But she does have pretty hair. Yeah. So again, this is the lower arch, and so we're going to angle our toothbrush at a 45-degree angle, not straight on like this. I'm not going to touch you, okay? Just trust me on this, okay? You're not going to. I don't look scary, huh? You're not going to straight on. You're going to add a 45-degree angle, little teeny circles, and then you're going to swish up. So, yep, angle down, little teeny circles, swish up. Then, if you're on your uppers, you're going to little teeny circles, swish down, okay?
If you have braces.
And braces, oh honey, you are getting a water pick.
No, I have one.
Okay, and you are using that twice a day.
Okay.
That's,
I use it once a day.
okay, you're using it twice now. Braces, you're going to at least look in,
Jam my
yeah,
toothbrush down there.
amen, amen, amen. You're going to go, okay? The best thing that I would recommend too is an electric toothbrush. And with that, you do just want to hold. With anybody with an electric toothbrush, you hold and you guide. But again,
Soft bristles?
yes, please. But the biggest thing is you want to angle it, again, at a 45-degree angle, no straight on. And then when you have braces, bless your heart, good luck flossing. But if you don't have braces, you're going to use floss. And I love to put mine in a circle and tie it, because then I can switch it easy like this, get a new piece each time. So I love putting mine in a circle and wrapping it around my middle fingers, and then use my 2 fingers to get more control. And that's why I keep it in a circle, because I don't have to wrap and have my fingers turn blue.
You do that twice a day too, or what?
So for me, I floss once a day, and I water pick in the morning and floss at night. For you, I would water pick, like I said, at least twice a day, and floss when you feel like spending 5 hours flossing your teeth.
Sometimes they put hydrogen peroxide in the water. Is that stupid?
No, that's great. That's brilliant. No, and for you, honestly, I would use this little doohickey, because that will get in between your teeth a lot better. I mean, flossing is so great if you can, but it just is so much time. You know what I'm saying?
When you have braces, you mean?
Yeah. And I love this one too for myself, because again, my gums have receded because I have periodontal disease, and that's what I use too.
Do you?
I do. Okay, but guess what? What's the most prevalent disease known to man?
She's popular.
So I'm going to shimmy down in. I'm not going to go straight down in. I'm going to shimmy on down in, and I'm going to hug the tooth. And then I'm going to bring it up, and I'm going to go over the gums, because as you remember, the gums make a knife edge. You just don't want to just take the floss and chop the gum off. So you're going to go up and over the gums, and then you're going to shimmy on down and hug the tooth and lift it up, and then come straight out. Don't come out like that, because you might get caught on something. Okay, because if you have dental work done, that you might get caught on that. Okay, so that's what I wanted. Thank you, teeth. Thank you, teeth. Thank you, teeth. So another thing that you can use too is shine to help, again, strengthen your teeth from the outside in. Do you understand what I mean by the inside out, by making sure that you're healthy, because then your body will get good nutrition into your blood, and then the blood will go in your tooth? Does that make sense? And that's how you'll strengthen those teeth from the inside out, and then from the outside in, you can use good, healthy toothpaste that will help strengthen your teeth. And we also use supplements to help in mouth rinses, and like I said,
Slyruta.
yes, to help with cleaning the gums and teeth.
And that has collagen in it, huh?
Okay, so there you go, and there we go. We're done.
We have question time.
Question time. Hopefully there's no questions.
Well, I just probably don't mind, but
Okay.
I know of somebody that chews ice all the time.
Yeah.
Yes, like
No, that's a good
Is it bad for the
question.
teeth?
Well, see,
It
here's
breaks 'em.
here's the thing, especially if you go from something from hot to cold, because when you have it heats and expands, and so yes, it definitely can help crack them, especially if you do hot and cold. But I know that some people just do it a lot, and I've also heard that that could be a mineral deficiency. So I would first find out why are they doing it, and just dive into what's the purpose for it.
We had that one old man that was chewing ice all the time, and he kept breaking his teeth, and his kids kept hiding all the ice from him. Where do you hide ice? I think it would melt. Huh?
Right?
We didn't check that. But his teeth were, but that would always break
Yeah.
his teeth. Perhaps it was because he was older.
See, that's the thing. Should they break when they're older? I mean, why? Why would they break? Is that
That's true.
because are they getting weak, and why are they getting weaker?
Yeah, because they are meant to last forever.
Yeah. And so, I mean, we use age as thinking that it is a disease because we do get more problems. But why are we getting more problems? I mean, why can't we just look on that, like, suck on a bottle and just be so, so cute? Right?
Sucked on a bottle our whole life, we wouldn't have issues probably.
Depends on what was in the bottle.
It could change your bite.
It's true. And then we wouldn't sleep right.
Do you just like rinse your mouth after you eat sugar and stuff, or like you gotta
If-
go brush?
Okay, that's a good question because if you have a lot of acid in your mouth, you don't want to brush your teeth. If you drink something like eat something very acidic, then you're like brushing your teeth with acid. Does that make sense? And so you would want to rinse. But if you're eating a lot of sugar, it hasn't turned to acid yet. Does that make sense? Because you need the formula because sugar plus bacteria equals acid.
Why not brush your teeth?
With very acidic food,
Like if you eat an orange.
Why not just go brush your teeth and clean them?
if you just eat sugar, yes. Yes.
Why not with anything?
But with a lot of acid, you're going to be more abrasive, and you can actually wear away your teeth with a toothbrush. Does that make sense?
And the toothpaste doesn't help that?
Well, it can, but sometimes even then your mouth is just so acidic. It depends on what you're drinking because
Baking soda toothpaste?
I know, but it's just that it's very acidic. It's what's in your mouth, and will it get neutralized quick enough with toothpaste? I mean, that's
Okay, so you're talking about, see, because now I have to learn about acid. You're talking about like if you have a drink of orange juice.
yes.
That's acidic. Rinse your mouth, then brush.
There you go. That's what I would recommend.
So you don't
Okay.
have to wait.
So that you're not just smearing acid onto your teeth.
Yeah, I wouldn't just go straight and get toothpaste and then start brushing your teeth. Be-
I've read a half an hour.
Yeah, and that's what I mean. But if you were to really rinse for a really good amount of time and then brush, that would be fine. But you would really need to rinse to try to get your mouth as alkaline as possible. And water is very alkaline. Does that make sense? And I have this cute patient. She's so cute. She got her teeth all done, and she loves her tea, but she doesn't want any, that's very acidic, and so she'll drink some tea, and then she has her warm water.
Oh, gosh.
And
Is it better to drink like coffee and orange juice and all that stuff through a straw?
well,
Like your teeth?
yeah, but really, coffee through a straw? I mean,
Well, Dr. Jorgensen does teach us to drink soda through a straw. If you have to
Yeah.
drink soda, she says drink it through a straw so
Yeah.
it bypasses your teeth,
yeah.
or chug it. But most people like go and get and just be done with it. But most
And
people,
nurse it like a baby. Yeah, they want to nurse their Coke as long as they can.
Yeah, most people go and buy a giant big gulp and then and drink it all day long, and that's an assault on your teeth all the time.
Okay, we have this one patient that he does not eat very much, but he seriously drinks 300 ounces of Mountain Dew
Ew.
a day. And he thinks that everything's fine, isn't it? Come on, witness with me. Be my sickness witness. And is it Diet Mountain Dew or is it regular Mountain Dew?
I think it's regular Mountain Dew.
Okay, yeah. And he
Everybody doesn't
he doesn't eat. But the thing is he said whatever. The number one ingredient is orange juice. Well, our second ingredient, I don't know, maybe.
In the dental community, there's a term called dew mouth. And that is from Mountain Dew having so much acid
Yeah,
in it.
yeah.
And
And the
eating
thing
holes in your
is,
teeth,
and
it
the thing
does.
is he actually, it's quite annoying that his teeth aren't that. I mean, they're messed up, but they're not as.
They should be worse.
Yeah, they should be worse. And I asked him what he does, and he chews Mentos all day long, which has a lot of xylitol in it, which helps.
Do plus
Mentogam.
And no food.
And no food.
No food. Xylitol helps stimulate your saliva, so that then it's like rinsing out your mouth. Yeah.
you take xylitol by the teaspoon or what?
Well, it can be too much for you. Yeah, it can be too much. So I wouldn't necessarily do that. I would do it more as a helper instead of as a cure.
Yeah.
More as a helper to help with, like if you know you're going to have a lot of sugar or a lot of acid, then yes, I would take a xylitol mint. If you know you're going to drink 300 ounces of Mountain Dew, then yes, I would chew on Mento gum.
Is there another way to get xylitol?
Through mints, or like she said, it's a sugar alcohol, and so you can just buy it in a powder form.
Instead of a health food store or what?
Amazon's your best friend. Yeah.
So then you put the powder in water?
Yeah, and or you could just put it in your drink, or you know.
Just tuck it in your mouth.
Or just but like again, just remember it might be a little bit, might make you loose in your gut. It might.
What if you just rinse it?
Yeah, and they have rinses that do have that in there. Yeah, there are mouth rinses that do have xylitol in it. I honestly, I do use it quite frequently, but I don't like anybody to use something regularly, because I like your body not to get used to it.
So same with Listerine?
So if you love Listerine, use that for, like if you love using a mouthwash every day, use that one for 2 weeks, and then go just to salt water, and then go back to your Listerine, or and then add that in too. Do you see what I'm saying? Like you have. Yeah, and that's what I do. That's why I use that one. I have another one that I use, and I love the Breath RX. And my other one is by Dr. Schultz, I think it's called, and I can't remember its name. But there's yes. You find the one, because as you know, every body is so different, and every body has different reactions and finds what works. Like I remember this one patient, his gums got better. Again, I see people regularly, and his gums got better. I said, "What did you do?" And he said, "I changed my toothbrush." He had like the kind of toothbrushes that are like this, where they look like a toothbrush, an electric toothbrush. He bought the other kind that was round and oscillates like this, and his gums got better. So sometimes it's just a matter, like again, you are your best doctor for you, and so you find what works for you, because every body is so different. And like this might be good for you, but maybe not really. Maybe this might be good for you. Do you see what I'm saying? And so sometimes that is tricky, and it is a mystery. Oh, bless my heart. And the biggest thing is scrape your tongue. Scrape your tongue. You see these teeth on here? I'm going to pass this around. There's teeth on here. You put this in a U shape. You go back as far as you can and scrape your tongue. You have goobers on your little nooks and crannies and little cilia on your tongue. Yes. It helps you taste, and then you scrape it so that then your food even tastes better. Pass that around.
I heard that once you become a regular tongue scraper, that your food tastes better. And
Because
like your taste buds have been dulled.
yes, because they've been coated.
Ew.
Yeah, and you'll be so surprised when you scrape it. You're like, who died on my mouth? And then and then you rinse it off and keep going until it's not dirty. And for sure, do it in the morning to keep your neighbors.
And it gets your favorite breath, right?
Yes, was it? Yeah,
We
yeah,
have some tongue scrapers back there.
Good.
If you want to grab.
5 packs of these on Amazon? Or
yeah. And they're reusable, and they're reusable. Yeah.
We have some back there for you too.
Yeah. Again, Amazon's your best friend.
Or just come here.
Or just come here.
I can
Yes,
do whatever
thank you.
want.
Thank you. Thank you. You guys were so great. Thanks for asking questions. Oh, we got more questions.
More questions.
So I was late, so you might have covered this. But
Probably not.
what do you do to keep your teeth so wet?
That is a great question. Do you know what I'm so glad she came in today. You know what she's been doing? She's been putting she makes a powder and she puts it in her bleach trays. She actually is in Invisalign right now. And so do you know what Invisalign is? It's braces that are clear that go over your teeth.
Okay.
And so she puts this in her teeth, in her trays, and then puts it on at night and goes to sleep, and it has really been whitening her teeth.
Who is that? A patient.
Yeah, I'm not allowed to say a
And
name.
we have, yeah, I said your daughter or something.
No, a patient, and she came in.
Home kits too.
Yeah, I mean, you can bleach your teeth with hydrogen peroxide, and that's one reason why, how they found out how to bleach teeth. They were like, okay, this anaerobic bug is causing gum disease and inflammation. Let's get some oxygen down in there. So they made some hydrogen peroxide, put it in trays, and they had people wear it. And while they were wearing it, like, their teeth are getting white. So bleaching is a side effect of trying to help with periodontal disease.
So if I have some bleach trays, because I haven't used them for a long time, because I started thinking I don't really want bleach,
Yeah,
then I can just put it all in that. I just
use
either
this
that or
and make a paste.
okay.
Yeah.
Probably feels
I mean, but
better than-
again, that's with her. I mean, remember, every body is so different.
Yeah.
So is that with the bleach or is
No,
that
no.
just that?
Just this.
Just that.
Yeah.
I also heard something, and I was listening to this thing. It was like one of those, I can't remember what you call it, you know, where they have like a webinar that's
Yeah.
only on for so long,
Yeah.
and then if you don't buy it, you don't
Yes.
anymore. And there was something on there that they did with vitamin C or something, because that's why I came tonight. I feel bad I'm late, but it was just because I have these bleeding gums. I know I have periodontal disease and inflammation, but they said that something that they mixed with the vitamin C that they took internally helped.
Well, vitamin C definitely is a huge thing, and we even, like I said, I had a patient that had major gum disease, and we would give her vitamin C, IV.
Infusion?
IV.
Do you guys do the infusions here?
And we actually do it big time before surgery, so because it helps with healing, and during the day of surgery and after surgery. And we have some other cocktails that we put in to make you feel good. Just kidding. It just sounded good the way I said it. Yes, thank you. And the Cyruta Plus really helps with gum disease. Yeah, take a look at that. It has rutin in it. The rutin is part of the vitamin C that helps with collagen. And
Okay, now that's awesome because my grandma, she was from Denmark, but she had really good legs, and she was always showing them. Like up in her 70s, she was just like, yeah, look at my legs, Never shaved them in a day of my life. And they were really good legs. She swore by rutin though. She said that every day she took
and it does
2 rutin pills,
and
so she never had any
varicose veins, and that's exactly what that helps. It helps with hemorrhoids, varicose veins, and bleeding gums.
So you tell it.
Well, other end.
Don't even start.
Right?
So you
Anyway,
tell
so
it.
Yes,
that's an old
yes.
fashioned remedy that really works.
Yes. Thank you all for coming, and thank you for your great questions. Yes, please.